Like and subscribe right now, or you're gonna have terrible luck for the next week.
From amputating the wrong leg to performing brain surgery on the wrong patient, here are 10 people who did the wrong surgery. Number 10. Massachusetts surgeon removes a functioning kidney. It's not every day that you bump into two different people with the same name, but when it happens in a hospital, things can get a bit out of hand. In 2016, St. Vincent Hospital in Worcester, Massachusetts, received two patients with the exact same names, but one of them had problems with his kidney. CT scans showed he had a huge tumor in one of his kidneys, which meant he needed it to be removed via surgery, of course. But along the way, the two patients' details were mixed up, and the wrong patient ended up on the table. And the mistake wasn't discovered well until the surgery was over and the kidney had already been removed. Post-operation tests on the kidney showed no signs of a tumor. According to media reports at the time, the mistake came down to the hospital staff not being keen on the patient's details. Yes, they shared a name, but a quick glance at their age would have helped the situation. Number 9. KENYAN doctors perform brain surgery on wrong patient. In 2018, two men were brought into the Kenyatta National Hospital unconscious but in need of different medical attention. One had a blood clot in his brain while the other suffered a swollen head. Being in the same ward didn't help the situation, as the hospital attendees ended up mixing up the two patients' tags. So the swollen head patient ended up in the theater for an operation he didn't need instead of the one with a blood clot. The doctors only realized the mistake after working on the patient for hours and noticing they weren't seeing any blood clots. According to a later statement, the doctors alleged that they called the ward 3 times and each time they were told they had the right patient. Of course, they had to cut surgery short after finding out that it wasn't the case. But as it turned out, the condition of the patient requiring surgery had improved, so he no longer needed the operation. There were wild reactions once the news of the blunder broke out, with almost everyone who was involved getting suspended, including the neurosurgeon, 2 nurses, and the National Hospital's CEO. Number 8. One-day-old boy gets a tongue clipping surgery. Yes, babies too can be the victims of the wrong surgery. In 2016, Nate, a one-day-old infant, was at the University Medical Center in Lebanon, Tennessee, with his mom for some checkups. According to the mother, Jennifer Melton, she expected the doctors to do a typical examination stuff like checking the weight and the blood type. Turns out, that wasn't the case. Her son had undergone a procedure called a frenectomy, which involves cutting the tissue that connects the tongue to the floor of the mouth. The mom only found out about the operation after she noticed some blood under the baby's tongue when he handed her back to her. The pediatrician admitted to making the mistake, acknowledging that he had called for the wrong infant. The mom, on the other hand, was furious and threatened legal action. Number 7. JESICA SANTILLAN, wrong heart and lung transplant. Jessica's story is a tragic one. Born in Mexico, she had a heart condition that led to inadequate blood reaching her lungs. To fix it, she was required to get a heart and lung transplant, a medical operation whose cost was way out of her family's reach. Somehow, though, the family managed to sneak Jessica into the United States and into Durham, North Carolina, in a quest to find her the best medical treatment. They were in luck as they managed to raise enough funds thanks to a Mac Mahoney, a local businessman who had read their story in the papers. A short while later, she received a heart and lung transplant at the Duke University Hospital. But just as the surgeons were wrapping up the operation, they discovered that the organ donor was a type A blood, which was incompatible with Jessica's O positive. Trying to prevent organ rejection didn't work, but they kept her on life support just long enough to get a compatible organ donor. But by then, the situation was already out of hand, and Jessica had suffered extensive brain damage. She died on February 21st, 2003, 2 days after her second organ transplant. Number 6. Eduviges Rodriguez, breast cancer removal. Anyone who knows anything about cancer will tell you that the best chances of treating the disease lie in early detection. It helps to nail down the cancerous cells as well as stopping them from causing havoc to a larger part of the body. Plus, the treatment at that stage is way cheaper. But for Eduvigis, the rush to remove supposed malignant cancer cells in her breast turned out to be a nightmare for her. A lump in her breast was erroneously diagnosed as cancer at the Mount Sinai Beth Israel Hospital in New York. She was then immediately sent to Lenox Hill Hospital to have the so-called cancerous lump removed, which, of course, meant in cutting off the affected breast. But well after the surgery, pathologists at the Lexington Hill discovered that the removed breast tissue didn't have any cancerous cells. Instead, it was just a bit of extra tissue growth that wasn't particularly harmful. Rodriguez was obviously gutted at the revelation, knowing she endured a procedure that she didn't need in the first place. And even worse, she had developed other problems as a result of the unnecessary mastectomy. All that could have been prevented if the medical staff at Lexington Hill had done their own tests before authorizing the surgery as per the facility's guidelines. In 2017, Rodriguez had initiated a medical malpractice suit against the two hospitals. Number 5. UK woman gets fallopian tube and ovary removed instead of appendix. While most of the wrong surgeries in this video are mainly because of record mix-ups and misdiagnosis, this is a bit different. The records were fine, the surgeon knew exactly what he was looking for and had the right patient, but either his site was a bit off or he just forgot the location of the organ he was supposed to remove. Instead of going for the appendix, he removed an ovary and a fallopian tube and termed the confusion as a minor mistake due to his poor vision, an excuse that was more of a spit in the face for the patient. Needless to say, not so many people were buying the sorry excuse. The Medical Practitioners Tribunal Service, for one, found the surgeon, Dr. Lawal Haruna, guilty of misconduct and struck him off from practicing. This mistake was his third in a little less than 2 years, which reflected rather poorly on his expertise as a surgeon. Number 4. Bimla Nayar, brain surgery for jaw displacement. 81-year-old Bimla Nayar was just recovering from a heart attack in 2012 when she was admitted to Oakwood Hospital in Dearborn, Michigan. All she needed this time around was a treatment for her bilateral jaw displacement, but a mix-up in CT scan results sent her to a coma she never recovered from. According to a lawsuit filed by her family, the hospital attendants mistakenly sent her grandma for immediate surgery thinking she was bleeding in her brain. She was whisked into the operating room where doctors got to work right away, drilling 5 holes into her head and sawing open the right side. But as they looked around, Nayar's brain didn't seem to have any problems, so they stitched her back up and informed the family of an unfortunate incident. The mistake turned out to be a costly one though. Nayar spent the next 60 days on life support and died on March 11th, 2012. While it cost the life of Nayar's family, the mistake also cost Oakwood Hospital $21 million, the amount awarded to the victim's family by the court. Number 3. Rhode Island hospital surgeon drills hole on the wrong side of the head. In 2007, Rhode Island Hospital had a series of wrong surgeries, a record of 3 in a span of a few months. The last one occurred November 23rd, involved an 82-year-old woman who was bleeding between her brain and her skull. To treat the problem, she needed an operation which, of course, meant drilling into the skull. The procedure kicked off as it should have, only that the surgeons were doing it in the wrong side of the head. Lucky for everyone though, the mistake was picked up early on and the doctors immediately stitched the lady up before switching to the other side. In something as sensitive as the brain, such a mistake could be costly. For instance, one of the earlier wrong surgeries in the hospital was done on an 86-year-old man who later died during an operation on the wrong side of the head. And that was after a CAT scan showed which side of the brain they needed to be working on.
Now it's time for today's best pick.
Today's photo was sent to us by a subscriber, so if you come across a photo online and you want to know more details about it, just send it over to us and we might even feature it in a future video. Number 2. Mr. Willie King gets the wrong leg amputated. In February 1995, for instance, a 52-year-old Willie King lost more than he had signed up for. King checked in at the University Community Hospital in Tampa, Florida, to have one of his legs amputated. Of course, he was granted his wish, but the leg that the doctor worked on was actually the good one. And worst of all, a nurse noticed the mistake when the doctor was way into the operation to make any quick corrections. The doctor, called Sanchez, denied responsibility for the grievous mistake, choosing instead to cast blame on the hospital staff that was involved in the surgery, which was kind of true. Every record in the hospital, from the blackboard in the operating room to the operating room schedule and the hospital computer, listed that wrong leg for amputation. Nevertheless, the doctor paid dearly for the botched operation, shelling out $10,000 fine and a further $250,000 as compensation to Mr. King.
Before we move on, I've got a little challenge for you that'll take 5 seconds to complete. So here's the deal. You just leave a like on this video, smash that subscribe button and hit the notification bell, and you will get 25 years of amazing luck. Try it, it really works.
Number 1. 83-year-old heart surgery for a respiratory infection. Back in 2014, an 83-year-old Rita Duplessis was booked into Mediclinic Kimberley in Johannesburg, South Africa for a respiratory infection treatment, but she ended up in the same ward with another patient, equally old, who needed heart surgery to remove excessive moisture around the heart. Coincidentally, the two had the same physician who was, let's say, not so keen on their surnames. So instead of sending the heart surgery patient to the surgeon, he sent Duplessis. He only found out the mistake later on when he realized Duplessis was missing during one of his ward rounds. By then, the operation was already over, and the surgeon had already contacted the family to tell them the surgery was a success. Luckily, there was no issues, but the hospital and everyone involved owned up, apologized, and wrote off the surgery costs. Hey everybody, thank you so much for watching today's video. If you have any comments, don't forget to leave them down below. Don't forget to also give yourself the free good luck by hitting the like button, and stay tuned for some more great content. See you next time.